Okay, guys, I'm going to start with number 1. The client's diagnosed with passive-aggressive personality disorder seen at the local mental health clinic. Common characteristic of persons with passive-aggressive personality disorder is A, superior intelligence, B, underlying hostility, C, dependence on others, or D, ability to share feelings. So guys, the correct answer for this is B, underlying hostility. Those patients that are passive aggressive, they really have underlying hostility. They are angry. And what happens is they don't know how to project their feelings adequately, okay? Or they're scared to. So what they'll do is they'll be nice, but make little snarky comments, right? But underlying, really what's going on with them is they are mad. They are very, very angry, and they don't know how to express it. So they'll be nice and just make little comments about whatever it is that's bothering them. Okay, so that's something very important you have to know about those patients that are passive aggressive. They do have underlying hostility. That's what's going on with them. Number 2, a client's admitted for evaluation of aggressive behavior and diagnosed with antisocial personality disorder. A key part of the care of this client is A, setting realistic limits, B, encouraging the client to express remorse for their behavior, C, minimizing interactions with other clients, or D, encouraging the client to act out feelings of rage. And I'll give you a second to think about your answer. And the correct answer for this is A, setting realistic limits. Here's the thing. These patients that are antisocial, and it's so weird because antisocial, you think, they don't like being around people. People say all the time, oh, I'm antisocial, I like being by myself. But when it comes to psych and personality disorders, antisocial means the opposite. These patients who are antisocial, they love people. They love socializing. These are the social butterflies. Why? They're con artists. These are the people who will turn into whoever you want them to be so they can finesse you out of your money. They can have sex with you, whatever it is that they want from you, okay? They are con artists. Those who are called, those who are antisocial, that's what they do, okay? They are social chameleons, okay? They'll be the one to make a 98-year-old woman fall in love with them and marry them so that they can steal all her money and they can get everything in the will and the children get nothing. And they don't feel bad about their behavior. They feel like the patients with antisocial personality disorder, they feel like, well, if you let me con you, it was your fault. You should have saw it coming. So these patients, you have to set very strict boundaries, because what they're going to do is try to be the nurse's best friend to get privileges, to be able to leave the facility. They will try to, what the young people call finesse. They will try to finesse whoever it is to get what they want. So with those type of patients, you have to set very strict boundaries. So when you see that term antisocial, I want you to think the opposite of what we usually think of antisocial, okay? I want you to think of a social butterfly. I want you to think of a con artist, because that's what these patients are, the ones with the antisocial personality disorder. Number 3, important intervention in monitoring the dietary compliance of a client with bulimia is A, allowing the client privacy during meal times, B, praising her for eating all her meals, C, observing her for 1 to 2 hours after meals, or D, encouraging her to choose food she likes and to eat in moderation. I'll give you a moment. The correct answer is C, observing her for 1 to 2 hours after meals. Why? These patients with bulimia, what do? They purge. After they eat, they feel guilty about eating. And so they'll go to the restroom and they'll purge, they'll vomit what they ate to get rid of it, or they'll like to try to take laxatives, whichever way, whether it's coming up or it's coming out, down that way, they're still trying to get it out of their body. So it's very important, those patients who are bulimic, after they eat, that they have a sitter, they have somebody one-on-one with them to sit with them to make sure that they don't purge. Something else is very important you guys need to know for NCLEX, ATI, HESI, whichever it is, major exam, when it comes to bulimia, these patients usually are normal weight or slightly overweight, okay? Compared to those patients who are anorexic, who are usually severely malnourished, severely underweight, okay? That's a big difference between bulimia and anorexia, which you guys do need to know. And the second biggest thing you need to know, anorexia, the patient just will not eat, right? Bulimia, they'll eat, but then they'll purge, okay? Number 4, assuming that all have achieved normal cognitive and emotional development, which of the following children is at greatest risk for accidental poisoning? A 6-month-old, B, a 4-year-old, C, a 12-year-old, and D, a 13-year-old. Well, guys, the correct answer is B, a 4-year-old. And the reason for that, if you look at the other choices, a 6-month-old, they're hardly even crawling, okay? So they can't walk to get to whatever the poison is. And let's say they do get to poison somehow, how are they able to open it? So cognitive, when you see that word cognitive, that means how someone thinks. Cognitive and emotionally, 6-month-old, we're not really concerned about that, right? Then you have the 12-year-old. At 12 years old, they can read, they can see if something's dangerous. They know not to ingest certain things. And the same thing with a 13-year-old. But a 4-year-old, that's where they're active, they're learning about their environment, you know, preschool age, they're not even in kindergarten yet, right? So that's out of the list we have, that's the patient that's most dangerous as far as accidental poisoning, and that's what we're worrying about, them getting into something that they shouldn't have gotten into and ingesting that poison, okay? Number 5, which of the following examples represents parallel play? A, Jenny and Tommy share their toys. B, Jimmy plays with his car besides Mary, who's playing with her doll. C, Kevin plays a game of Scrabble with Kate and Sue. Or D, Mary plays a handheld game while sitting in her mother's lap. And the correct answer for this, guys, is B, Jimmy plays with his car besides Mary, who's playing with her doll. So parallel play is when 2 or more children are playing, but they're playing with their toys, but they're playing next to each other, okay? So it's not interactive play. They're not playing with each other. They're just playing with their own toys, but they're doing it next to another child, okay? That's what parallel play means. Number 6, the nurse is ready to begin an exam on a 9-month-old infant. The child is sitting in his mother's lap. Which should the nurse do first? A, check the Babinski reflex. B, listen to the heart and lung sounds. C, palpate the abdomen. D, check tympanic membranes. And the correct answer to that, guys, is B, listen to heart and lung sounds. And let me tell you why. When it comes to peds, well, guys, generally speaking, this is even for adults, right? We always want to go from least invasive to most invasive, right? You guys learned that in semester 1 of nursing and fundies, right? Before you palpate, what do? You want to look, right? You want to look at your patient, and the next thing you want to do is listen, especially when it comes to peds. If that child is calm, they're on their mother's lap, while that child is quiet, you want to be able to listen and hear the lung sounds and be able to hear the heart rate and see how fast it is and see what it sounds like. Do you hear a murmur? While that child's quiet. If you go and look in their ear or you're palpate, you're touching them, they may start crying. So you want to do something that is not invasive, that they'll remain calm before you move on. Number 7, in terms of cognitive development, a 2-year-old would be expected to A, think abstractly, B, use magical thinking, C, understand conservation of matter, or D, see things from the perspective of others. And the correct answer is B, use magical thinking. And that's why at that age, you give them the bedtime stories, and they like to hear about the wizards or the witches and the princess. And this is the age where they have the imagination thinking. They cannot think abstractly yet. Something has to be in front of them for them to be able to make sense of it. Conservation of matter, they're not there yet. Conservation of matter, guys, that's when you can have 150 milliliters of water and you have it in a glass. and the glass is this tall. And then you have 150 mLs, and you have it in a glass, but instead of the glass being tall like this, right, the glass goes this way, right? Conservation of matter is when they can understand if it's 150 mLs, the one that's tall is going to be the same that's short, right? As long as it's the 150 mLs, okay? And of course, seeing things from the perspective of others. 2-year-olds, no way, they're toddlers. They're what? Egocentric. They can only see things from their point of view. That's why it doesn't work with a 2-year-old when you're saying, oh, you know, why did you hit Tommy? How would you feel if he hit you? They're unable to think from another person's point of view, okay? They're egocentric. Everything in their world revolves around who? Them, the 2-year-old, and that's the toddler, okay? Number 8, which of the following best describes the language of a 24-month-old? Okay, so the child's 2 years old. A, doesn't understand yes and no. B, understands the meaning of words. C, able to verbalize needs. D, asks why to most statements. And the correct answer is C, able to verbalize needs. At 2 years old, you know, if they have to go to the potty, they'll say potty, they'll say juice, they'll say sippy cup. They'll be able to verbalize what they want. You see the D where it says ask why to most questions? That's around the 4-year-old. That's around the preschool age where they're learning about their environment and they want to know why, okay? They want to know about everything, why they're doing certain things. A, doesn't understand yes or no. Oh yes, by 18 months they're understanding yes or no. If they're doing something and you say no, they understand no. They might stop for a moment, look at you, and then keep doing what they were doing, right? But they understand what that means when you say no and you say yes, okay? Number 9, a client who has been receiving urokinase has a large bloody bowel movement. Which action would be best for the nurse to take immediately? A, administer vitamin K IM. B, stop the urokinase. C, reduce the urokinase and administer heparin. Or D, stop the urokinase and call the doctor. Okay, guys, so the correct answer is D, stop the urokinase and call the doctor. So this is a concept that you guys have to know for testing period. Whenever a patient's getting an infusion, and during the infusion, that patient is getting an adverse reaction, that is something that we do not want to see happen, the very first thing that you do is stop the infusion. Does it make sense for you to turn your back, call the doctor, and whatever it is that's killing that patient is still running through their system? It makes no sense. The first thing you're going to do is stop it. Then with the selection of questions you got, you're going to call the doctor, okay? Look at A, administer vitamin K. Well, guys, you know vitamin K is an antidote for what? Coumadin, right? Coumadin stops the blood from clotting, and so if the patient starts clotting a little bit too much, we can reverse that with the vitamin K. But how are you going to go ahead and do that and you don't have a doctor's order, right? You had to call the doctor to get that order, right? And you're going to sit there and give them vitamin K and that infusion is still running? I don't think so. Okay? B, stop the urokinase. That's wonderful, but it doesn't take it a step further. So you're going to stop the urokinase and do nothing, right? If D, that choice of D was not there, you would have obviously chosen number 2. But the correct answer, which was stop the urokinase, it went a step further. After you stop it, you do what? You call the doctor for orders. And last C, stop your urokinase and administer heparin. Absolutely not. Okay, this patient's already bleeding out, right? Okay. So that's why D is the correct answer. Number 10, a client has a prescription for calcium carbonate compound to neutralize stomach acid. The nurse should assess the client for A, constipation, B, hyperphosphatemia, C, hypomagnesemia, or D, diarrhea. And guys, the correct answer is A. Okay, that calcium and the calcium carbonate, what it does, it's binding, so it can cause constipation, so you have to watch out for that. I want you guys to also notice something else. A and D are two opposites. What did I teach you? When you're doing questions and you see choices and you don't know what the answers are, but you see two opposites, choose one of those opposites, and one of those opposites are most likely one of your answers, and this is a perfect example, right? You have A, which is constipation, and D is diarrhea. If you had no idea what the answer was, take a chance between A and D, right? All right, number 11. Heparin's been ordered for a client with pulmonary embolus. Which statement, if made by the graduate nurse, indicates a lack of understanding of the medication? 1, I'll administer the medication 1 to 2 inches away from the umbilicus. 2, I'll administer the medication in the abdomen. 3, I'll check the PTT before administering the medication. Or 4, I'll need to aspirate when I give heparin. So the correct answer is D, I'll need to aspirate when I give heparin. Because what is this question really asking us? This question's asking us which one is wrong, right? And D's the wrong one. Do you aspirate when you give heparin? No. First of all, how are you giving heparin? It's sub-Q, right? So we don't need to check to see if we're in a vessel. You're giving it sub-Q. All the other answers are correct. Yes, you're gonna give it 1 to 2. You can give it 1 to 2 inches away from the umbilicus. In the abdomen, it's gonna be sub-Q. And yes, you're gonna be checking PTT. When it's heparin, you're checking PTT. And when it's Coumadin, you're checking PTINR, okay? Number 12, the nurse is caring for a client with peripheral vascular disease. To correctly assess the O2 sat level, the monitor may be placed on the A, hip, B, ankle, C, earlobe, or D, chin. And the correct answer, guys, is C, earlobe. And another place you can check it, if you can't check it on the fingernail, you can do it on the toenail as well. Okay, preferably you want to make sure you do, make sure the patient doesn't have any nail polish so you can get a good reading. Number 13, when caring for a client with hypertension, the nurse notes that the following vital signs: blood pressure of 140/20, pulse 120, respirations 36, temperature 100.8. The nurse's initial action: call the doctor. Call the doctor. Okay, you're gonna need orders. And guys, I've taught you this before. Before you choose the answer of call the doctor, because usually there's always something you as the nurse can do, okay? But I want you to look at these choices. You have call the doctor, you have recheck the vital signs, you have obtain arterial blood gases, and D is obtain an ECG. Now, as a nursing student, you should have automatically gotten rid of C and D. Why? You need a doctor's order for the blood gases, the ABGs, and the ECG, right? So you have to call the doctor first before you can get those. So as a student, I would throw C and D out. That would not be my first choice because I know I got to call the doctor. That leaves me between A and B. Why are you going to waste time to recheck the vital signs? So you mean to tell me the blood pressure, the pulse, the respirations, and the temperature can all be wrong? Come on, don't waste time. You're going to call the doctor, okay? Number 14, the nurse is preparing a client with an axillopopliteal bypass graft for discharge. The client should be taught to avoid A, using a recliner to rest, B, resting in the supine position, C, sitting in a straight chair, or D, sleeping in right Sims position. And the correct answer, guys, is C, sitting in a straight chair. Why? If that patient's getting an axillopopliteal bypass, where's the popliteal area? That's right behind where? The knee, right? So you need that knee area to be straight, not flexed. So if a patient's sitting in a straight chair, their leg, that knee area is going to be flexed at a 90-degree angle. No, you want that leg lying straight. So they either need to be lying down in the bed with the leg straight, or they need to be lying down on a lazy boy. You know how the bottom of the lazy boy lifts up so their leg can be straight, right? You don't want that patient bending their knee at all, because that bypass is going where? Right behind the knee. So you don't want any flexion whatsoever. I'm sorry, I keep getting tear in my face. Number 15, doctors ordered antithrombotic stockings to be applied to the legs of the client with peripheral vascular disease. The nurse knows that antithrombotic stockings should be applied A, before rising in the morning, B, with the client in a standing position, C, after bathing and applying powder, D, before retiring in the evening. And the correct answer is A, before rising in the morning, okay? Those stockings need to be put on while the patient's still in bed. Before they get out of bed in the morning, that's when those stockings have to go on. And then when they're coming to bed to go to sleep at night, that's when they're taken off, okay? Number 16, the nurse has just received the shift report and is preparing to make rounds. Which client should be seen first? A, the client with a history of cerebral aneurysm with an O2 sat of 99%. B, the client 3 days post-coronary artery bypass graft with a temperature of 100.2. C, the client admitted an hour ago with shortness of breath. Or D, the client being prepared for discharge following a femoral popliteal bypass graft. And guys, the correct answer is C, the client that came in with shortness of breath. If you haven't seen my video that I did in regards to priority, which patients must be seen first, I encourage you guys to go watch that. Okay, I go over different scenarios in which patients take priority. And guys, this is a perfect example. That patient that had shortness of breath, they're going to take priority over, let's look at our other choices. The patient with an O2 sat of 99, that's great, okay? Second, the patient that's 3 days post-op and they have 100.2. Very, very low-grade fever, and they had the surgery 3 days ago. Yes, we're gonna go check them, but they're not gonna take priority over patient that had difficulty breathing. And the last choice was a client prepared for discharge. So no, absolutely not. Who we're going to be running to, our first priority is a patient that had shortness of breath. Number 17, a client with femoral popliteal bypass graft is assigned to a semi-private room. The most suitable roommate for this client is a client with A, hypothyroidism, B, diabetic ulcers, C, ulcerative colitis, or D, pneumonia. And the correct answer is A, hypothyroidism. There's a couple things I want you guys to notice about this. The first thing I want you to notice is B, C, and D all have something in common. Okay, A is the only one that does. B, C, and D are all types of infections. So if you guys are doing, you guys are going over a question and you have no idea what the answers are, look to see if you see something common among all of the answers except for one, because B, C, and D are all types of infections. So as a student, even if I didn't know what the answer was, if I noticed that all of them are infections except for one, I would have chosen the exception, which is the correct answer, hypothyroidism. That's the first thing I want to point out to you. The second thing I want to point out to you, remember, you never put a patient in a room that does not have an infection, with a patient that does have an infection, okay? You never want to do that. If you're forced to put a patient that has an infection in a room with another patient, you always want it to be another patient, preferably with the same type of infection. But if that's not a choice, you want it to be another patient that has an infection, not another patient without infection. That's number two. Here's the third thing I want to bring to your attention. So this patient who just had surgery, that patient that has hypothyroidism, what are they going to do all day? Remember, the patient who has hypothyroidism, everything is low. Blood pressure, down. Heart rate, down. They're thinking, down. Patients with hypothyroidism, they're not talkers, right? When I tell you everything slows down, even their cognitive ability slows down. That's why those patients that have hypothyroidism, if you give them instructions, you have to repeat it sometimes. Why? And if you ask them questions, you have to wait for them to give you an answer. Why? Because it takes time for them to formulate their thoughts. They're not going to be talking. So that's a perfect person to give them with someone who just had surgery, because they won't bug them. They'll allow that person who just had surgery to rest, because the patient with hypothyroidism, what are they doing themselves? Resting. Okay. So that's the 3 things I wanted to point out with number 17. Number 18, the nurse is teaching the client regarding the use of sodium warfarin. Which statement made by the client would require further teaching? A, I will have my blood drawn every month. B, I will assess my skin for a rash. C, I will take aspirin for a headache. D, I will use an electric razor to shave. And guys, the correct answer is C, I'll take an aspirin for headache, because what this question is really asking us is which one's wrong, which one is incorrect. And C is obviously incorrect. Why? Because Coumadin, what does it do? Thins your blood, right? It keeps the patients from having clots. That's why you see A where it says I have my blood drawn every month. That's correct. If a patient's on Coumadin, that blood draw that patient's getting every month, that's what's called the PT-INR. I just talked to you guys about that. The patient's taking Coumadin, they're going to get their blood drawn, which is the PT-INR. So that's correct. B, I'll assess my skin for a rash. Yeah, because guess what? If that Coumadin level's too high, that patient will start what? Bleeding out, and the patient will start having bruises on their body. So when the patient says rash, that's what they're talking about. The bruising that you'll see under the skin, also known as the ecchymosis, right? D, I'll use an electric razor to shave. Absolutely, you're going to teach the patient that. Why? Because those are bleeding precautions. You want to make sure the patient's not bleeding out. Other things you're going to teach them, you're going to teach them to use a soft toothbrush when they're brushing their teeth, because you don't want them to start bleeding through their gums, right? You're going to teach them to, when they use the restroom, to check their stool to make sure they're not bleeding out through their stool. Why? We're going to put them on bleeding precautions. So the only wrong answer is, if I have a headache, I'll take an aspirin. Why? What does aspirin do? Thins the blood. So it puts that patient at risk, it puts that patient at risk for bleeding, which is what Coumadin already does. Number 19, a client returns to recovery room following repair of abdominal aneurysm. Which finding would require further investigation? A, pedal pulse is regular. B, urine output 20 mLs in the past hour. C, blood pressure 108/50. D, O2 sat 97. The correct answer is B. As a student, guys, you guys should have automatically gotten rid of A and D. Why? Pedal pulse is regular. That's what you want, right? So that doesn't require further investigation. Whenever you see something says require further investigation, they're asking you what's the wrong answer. So we get rid of A. D, oxygen saturation 97%. That's wonderful. We want the O2 sat to be between 98 to 100. If it's 95, we'll take it, but we like it to be between 98 and 100. So 97, that's great. So that leaves us with B and C. B, which is a urine output of 20 mLs, and C, blood pressure of 108/60. Now, we know that our blood pressure range is 90/60 to 140/90. Depending on which book you're using, the numbers might there might be a variation by about 5. That's fine. So 108/50. That 50 may be a little low. So as a student, I would be looking at that. But guess what takes priority? The urine output of 20 mLs. What is your urine output supposed to be? At least 30 mLs per hour. 30 mLs, that's your minimum. And the reason that's so important to us is, as I've taught you guys before, those kidneys are the gateway. Those kidneys are usually one of the first things to let you know something severely wrong with the patient, right? So when we see urine output go down and we see BUN and creatinine go up, we know there's a big problem. Something's going on with that patient, okay? So if that patient's pushing out only 20 mLs an hour, not even 30, that needs to be investigated. That's letting us know something's wrong. Number 20. The nurse is doing bowel and bladder retraining for the client with paraplegia. Which of the following is not a factor for the nurse to consider? A, diet pattern, 2, mobility, C, fluid intake, or 4, sexual function. The correct answer is D, sexual function. Why? If you're doing a bowel and bladder retraining program, look at A, B, and C. All those three are necessary for the bowel and bladder. Dietary patterns, right? You want to get this patient on a schedule with their bowel and bladder. Guess what? They got to be eating things that are high in fiber, right? Drinking fluids appropriately. So that's going to be very important when it comes to dietary patterns. When they're eating, what they're eating makes a big difference, especially with the bowel retraining. And of course, mobility, right? When patients are constipated, what do we teach them? Get up and move around. When that patient gets more mobile, what happens? It increases the peristalsis, so it will help the patient be able to have bowel movements. And of course, fluid intake, that helps that patient not be constipated, help the patient to have bowel movements, and of course, urinate as needed. So A, B, and C are definitely needed for bowel and bladder retraining program, not sexual function. Number 21, a 20-year-old admitted to the rehab unit following a motorcycle accident. Which would be appropriate method for measuring the client's crutches? Measuring the client for crutches. A, measure 5-finger breadths under the axilla. B, measure 3 inches under the axilla. C, measure the client with the elbows flexed 10 degrees. Or D, measure the client with crutches 20 inches from the side of the foot. Okay, guys, so the correct answer is B, measure 3 inches under the axilla. That's what you want to do. And guess what? It's easy to do because the 3 inches is your 3-finger breadths, right? So those 3-finger breadths right under their armpit, there should be that much room between their armpit and the crutches, okay? Their armpit should never be resting on those crutches at all. And so those patients who are using crutches have to have upper body strength. That's why you never see the elderly 80, 60, 70, 80-year-olds on crutches. Okay, because you have to have that upper body strength to keep your axilla and those 3-finger breadths or the 3 inches away from the head of those crutches. They cannot be resting on the crutches. Number 22, the nurse is caring for a client following a CVA. Which portion of the brain is responsible for taste, smell, and hearing? And the correct answer, guys, is the temporal. Okay. Number 23, clients admitted to the unit after MVA with a temperature of 102 rectally. The most likely explanation for elevation temperature is that A, there was damage to the hypothalamus. 2, he has an infection from the abrasions to the head and face. 3, he'll require cooling blanket to decrease the temperature. Or 4, there was damage to the frontal lobe of the brain. All right, guys, so I want you guys to look at this question. And what they're asking is, what is the most likely reason that the patient's having an elevation in their temperature? As a student, you should automatically get rid of C, saying he will require a cooling blanket. That doesn't answer the question. The question says, why does this patient have an increased temperature? What is the most likely reason that the patient's temperature is increased? And C is not even answering it. So as a student, you should have gotten rid of C automatically. So that leaves you with A, B, and D. Look at B. He has an infection from the abrasions to his head and face. That patient just got in an accident. There's not enough time for that patient to develop an infection from the accident for them to have a temperature. They just got in the accident. So as a student, you should have got rid of B. Okay? It's too soon for that patient to develop any type of infection from the accident. So that leaves you with A or D. Either A, there was damage to the hypothalamus, or D, there was damage to the frontal lobe of the brain. And the correct answer is A, because remember, where thermoregulation is controlled, the hypothalamus of the brain. So the answer is A. Number 24, the client's admitted to the hospital in chronic renal failure. A diet low in protein is ordered. The rationale for low protein diet is A, protein breaks down into blood, urine, nitrogen, and other waste. B, high protein increases the sodium and potassium levels. C, high protein diet decreases albumin production. D, high protein diet depletes calcium and phosphorus. And guys, the correct answer to this question is A. Protein breaks down into blood, urea, nitrogen, and other waste. Blood, urea, nitrogen, BUN. Okay, so that's what happened when you eat protein, you eat meat, anything that's protein. The byproduct of that protein is nitrogenous waste, right? Well, you have that nitrogenous waste in your blood. What's the organ that's supposed to filter that out of your blood and get it out of your system? Your kidneys. But look, the patient's in kidney failure. So why would you give a patient something to make the kidneys work harder when the kidneys are in trouble? That's why when a patient's in renal failure, which means the kidneys are in trouble, the patient's going to be on a low protein diet, because when you eat that protein, when the protein gets broken down, the byproduct of that protein is waste. And who's supposed to filter the waste? The kidneys, and the kidneys are in trouble. The kidneys can't filter that waste. So what happens? The patient gets a buildup of this toxic waste in their body, and now we have other issues, okay? So that is why A is the correct answer. I'm going to be doing more questions with you guys shortly, so be looking out for, please make sure you guys look out for that video. It'll be coming shortly.